It's been over a year, I think, since we've made a Social Security video.
Wow, has it really been that long?
Well, I think so. It was shortly after we started the channel. And at that point, we thought that we would wait till you were 70 and I would take it at 62.
Well, yeah, and it really makes sense for us to do that because of the amount of money that we'll get, the difference between 67 and 70. It's such a great difference.
But we're not going to do that anymore.
Right, true. We decided that we're not going to do that. We've researched it a little bit more, and we're going to...
Well, it's always fluid, always changing, right?
Right.
But our new goal is for Steve to take it at 68 and me to take it at maybe 63.
And 68 is a good number, too.
But what is your full retirement age?
Well, my full retirement age is 66 and 10 months is my full retirement age.
For Social Security.
For Social Security. So, at 67, 68, we're close.
Well, Steve is 65 now, so he hasn't taken it yet. I'm 60, just 60. And so the first time I'm eligible would be a year and a half.
Right.
And we want Steve to reach at least his full retirement age or possibly 68. There's a couple of things that I learned recently that kind of made me get to thinking, a couple of almost sad things. I watched Incredible Tiny Homes, and one woman who, they didn't say her age, but she was elderly. She lived in the tiniest, the 8x16, that I think she probably paid $20,000 and paid $200 a month rent. It's in Newport, Tennessee. And she had car trouble, so she couldn't even afford to keep this tiny home, which there's nothing cheaper than that with rent or anything. And that kind of broke my heart that I thought that's every woman's biggest fear is to become a bag lady.
Well, it's not just every woman. I mean, it's every person's fear. Nobody ever wants to have to lose everything and become someone who lives on the street or lives in their car or van, whatever it may be. But, it could happen. It could happen to anyone.
I believe women are more vulnerable because they've always been paid quite a bit less than men. And we are the caretakers. So we worked less years taking care of our children, our parents, whoever needed help. It was always the women. That's well known that. So I think that every woman's fear is to be a bag lady.
Right.
So it was really sad that she actually was moving in with a friend and selling her tiny home, and she sold it for $30,000, just under $30,000. And I just thought that is the saddest thing ever, to be vulnerable and sick. And then I see a lot of videos from the UK talking about how in America we don't treat our elderly very nicely, that they are vulnerable after working so many years, working a full career or whatever. But the second piece of information that I learned was my sister is seeing a financial advisor, and he told her that she may live to 94. And I was like,
wow.
Now, I did my life expectancy on Social Security, and I don't remember right now. I'll put it on the screen. I think it was, what did we say before, 87 or something?
Something close to that.
So I thought 94 is really a long time.
It's a long time, yep.
But there is a Social Security calculator that you can calculate spousal benefits. If you're looking at spousal benefits, that you just put in your birthday and then when you want to take it, and they'll tell you the percent of your spouse, and then you have to figure out your spouse's. So you have to know what your spouse is getting, and then you multiply that percent by that, and it goes up a very slight amount each month that you wait. Right. So that's a great calculator that helps you. It's a good tool to know what you might be getting.
Yeah, and I know it sounds kind of selfish to figure all this out on your spouse and how much you're going to get, but you know something? You have to survive. And you have to survive whether your spouse is around or not, and so you have to know what kind of income you're going to have so you can budget for the future.
And the spousal one, your spouse is alive. Its survival one is once your spouse has passed away. And my understanding, and I could very well be wrong, is that when I get the spousal one, if Steve were to pass away and I didn't want to take the survival one at that point, I believe they'll go back to my Social Security And that's very, very low. Now, I'm not positive. I'm sure most people would just go ahead and take the survival one because
Right.
I couldn't live on mine, and Steve's would be greatly reduced at that point. That's why I'm trying to hold off on taking mine to up that amount just a little bit. If I wait till I'm 63, it will up it a little bit. But we're reevaluating this every day, every month. And Steve, why don't you tell them why we thought we can't wait until you're 70?
So not taking it now, but taking it at 68 is considering that prices are going to keep going up, so inflation is going to continue. Also, you don't know what tomorrow holds. I mean, I think that we're rolling the dice, waiting. You don't know what tomorrow holds, like I said. And so you want to get as much benefit out of free money as you possibly could, even though you've paid into it for your whole life.
Right.
That
So,
you've been working. It's not free money.
No, not free.
But, as prices go up, the value of how much you get in Social Security comes down. Social Security only goes up a small percentage each year to cover inflation, but inflation's going up a lot higher, a lot faster.
Social Security is tied to inflation. It's supposed to be rising with inflation each year.
Well, I don't believe it is.
It's rising with what the government inflation is, but
Right.
Healthcare costs inflation is way beyond that number, and that's what your most expenses are going to be as
Right.
we age.
Groceries, car insurance, homeowners insurance, all of that continues to rise, and it's the kind of thing where you just can't catch up. So taking your Social Security may help you, and so taking it sooner than later could be a plus, and you have to figure it out from your own life expectancy and your expenses and what your income is.
Well, another reason is Steve had hoped to work to 70. He's considering retiring before 70, and I need health insurance, and that's going to be totally outrageous. That with his may be up to $1,500 a month. So one reason we're considering taking it before 70 is if he does retire, we may have to pay $1,500 a month health insurance, which is a good reason why he's still working because that's unaffordable, $1,500 a month.
Right.
So
kind of crazy.
So now his would be roughly $300 to $400. Mine would be $1,100 to $1,200 through the Affordable Care Act. The way I believe we could reduce my health insurance is by getting subsidies, and you'd have to have lower income. So for us to do that, we would have to sell our house, live on the equity, and show as low income as possible. Our state is one of the 10 that did not expand the Medicaid expansion. There's only 10 out of 50 that did not expand it. We are in Georgia, one in the 10. So you have to have a certain low level of income, like 15 or 20,000. I don't know what the number is. You have to have at least that. But to get subsidies, you have to have at least that, and then I would guess below maybe 40 or 50. I don't really know. I mean, it depends. The lower the income, the more the subsidy. Except if it's below 15,000, you won't get any subsidy. So you have to play around with numbers. We would probably have to sell our house. If you live in another country and don't have to deal with this, consider yourself lucky.
Very lucky.
I know
Very
we watch a couple in Canada who this is our retirement, and they talk about retiring in Canada or America, and I don't think it's like apples and oranges. The health insurance factor is the wild card. It's the wild card. It's out of control. And I know they mentioned on one of their videos, that's Tina and Norm, that they do pay for their dental and their glasses. But our health insurance premium was alone would be $15,000.
Right.
And that doesn't cover anything. That doesn't cover checkups, medicine, testing, nothing.
Right. And so their health care comes out from taxes that they pay. And so that makes you're still paying for it, but it's the kind of thing where it comes out from taxes. So if you're working, you have a higher tax rate that your pay is taxed at. But your health care, there is no extra cost. And
But
there is also disadvantages to
but they have a major advantage. Their cost is nowhere near our cost. Even if they pay it through their taxes, they've capped their cost at a reasonable cost. I mean, going to the ER cost me $6,000 for a 4-hour visit, and they didn't even do that much. Didn't even tell me why I had vertigo. I know nothing more, and I regret even going. $6,000. When I had gone to the ER over 20 years ago, had emergency gallbladder surgery, what did we pay? $60 because of my private room?
Right.
I mean, I had surgery, CT, MRIs, everything. $60, now $6,000 for, so no. It's the wild card, and that's the reason Steve is continuing to work, is basically the health insurance coverage, which again, even though the premiums aren't $15,000, the deductible is what, over $6,000.
Yeah, it's a high deductible, and with the family deductible, it's $13,500.
But that's all we have offered. That's the best
Right.
insurance he could get through his job. There's nothing better. It's not that we're being cheap, and we pay a good amount of money for that insurance.
Sure.
So that insurance is a wild card. If you're in Canada, you're very fortunate. They also have a subsidized apartment, which those are far and few between in America. And I don't know if they would count. I don't know how they figure that. I don't know if they just look at income, or if they look at if you sold your house and had equity in the bank, if they would count that.
Right.
And I don't really know.
Don't know.
But we know rents. I've been looking at rents in a lot of states: South Carolina, North Carolina, Alabama, Georgia. And your rent's going to be at least $2,200 to $2,700 for a small, maybe 2-bedroom apartment. And they tack on a lot of extras for one of the dogs. Of course, that's on us. That's like probably $40 a month plus $500. And then there's like garbage that you don't have a choice in. They charge for like garbage or all these extra little fees. Some charge for renter's insurance, just things. When we rented apartments, or I did when we first met, water was included and there was no other fees. That was it. There was no dog fee, monthly dog fee, or renter's insurance, or garbage, or anything. Now there's a lot of fees that you may not know about. So we're looking for more affordable housing, and I haven't been able to find it.
Yeah, it's few and far between. You have to really search, and it could take a few years, but we are definitely in the search for more affordable housing.
I don't think it exists. I know a lot of people say they feel for millennials that they can't buy a house, and I feel for them too. But we went through that right before the Great Recession. Housing was outrageous. We bought at the peak, and then it crashed, and so we didn't make anything on our last house that we sold. And I feel that they can't get a house, but it's also hitting all age groups, not just millennials. It's hitting everybody.
Right.
I mean, boomers are becoming the fastest growing homeless population. They are the fastest % of homeless people.
Right. And that's sad. I mean, it's really sad because you have a large number of boomers, and, that they have no other choice.
Well, when your rent goes up $500 a month and you're living on Social Security and you're unable to work, or you won't even make that much if you did work. I mean, it's I don't know what the solution is. I mean, housing is really unaffordable. So even looking at smaller houses in our area, they cost as much as our house. If you look at a 2-bedroom, they market it as a retirement home, and it costs just as much. And it might be 15, 20 years old. So our utilities are so great because this house is 4 years old. Our utilities, at least electric, we don't have gas. Electric is so affordable. So if you do get an older home, it's probably going to double. And like in Newport, in the tiny homes, they say they're electric, and they pay almost as much as us. In one of those tiny homes, a lot of them pay $70 to $100 a month, and that's about what we pay. And I'm thinking, in that little tiny home, you pay as much as we pay.
And everything in our house is electric.
Right, we have no gas, and they don't have gas unless they have a propane tank for. Some of them might have that for a stove or something, but but mostly it's just electric. So, I mean, we've been looking
Yeah.
at all options, the tiny homes, the apartments, and we're going to go visit them. We haven't actually visited them because you can see online how much rents are, but we're going to visit apartments. And we also looked at a Doublewide, which was really nice, but it's a problem finding land for that Doublewide.
Yeah.
And then you might pay $800 a month, and you have that risk of them selling that land, and then you'd have to relocate. So that's another issue too. We've considered that. It was like $140 for a 1,500 square foot brand new Doublewide, and it had 4 bedrooms. It was very nice. But again, you've got to get that land, and if you buy the land, you've got to spend $10,000 to $20,000 preparing that land.
Right.
So people think, oh, just sell your home, get a smaller home. You do the math, and it's
hard to do that. You can't just do that tomorrow. I mean,
well, it's not. I mean, you're not really saving money after you pay the fees of selling it,
to do that.
and then you buy the new one. But I mean, we've even considered going to North Carolina that has expanded Medicaid. They expanded it last year, and we get more affordable insurance for you. But there's all the costs of moving, so they may be ending up in saving that money. So, you know, we thought there's a lot of nice cities. We went to Hickory on vacation, and we like Asheville, and there's a lot of nice cities. Asheville's totally unaffordable with rents, but Hickory might be affordable. Hickory is centrally located between Asheville and Charlotte, so it's a good location. We loved Virginia. They've have expanded Medicaid as well, but we don't like snow and cold. We don't really want to get up into that. So there's a lot of factors to consider. Our hospitals have been closing because we didn't expand Medicaid. And the ones that are open are just gouging you, like we saw when I went to the ER. So there's just so many factors to consider in looking for the perfect place to retire.
Yeah, you can't just make a snap decision. You have to weigh all options and, you know, think about it. It's not something that just happens tomorrow. I mean, retirement is somewhat permanent. I mean, you can always go back, look for a job and go back to work. But what kind of job are you going to find, and is it going to pay you the amount that you need? So thinking, planning, real important, and making sure that you are making the right decision. Unless you're sick or you can't work anymore for whatever reason, think about it. Think about retiring and think about what it takes to retire. It's not just, oh, well, I'm getting this much of Social Security, I can live, you know, but you got to think about the what ifs. You know, what if this happens? What if that happens? And, you know, it may sound funny or odd, but it's not. That's really called strategic planning. And you really have to be a strategic planner because you have very limited income coming in. That's why they call it income. And so you have to use that money very wisely to make it last. So you don't have to panic, be homeless, sleep in your car or your van, or, you know, find a job that you hate just to be able to put a roof over your head. I mean, that's probably not even realistic. You know, if you get a job, you still live in your car or in a van these days, and what that would pay for is some food, but that's about it.
I know, I watch a lot of those videos where women live in their cars, and it is mostly women, and they put on a happy face like they choose that, and I know they don't. That is so unhealthy and so miserable. I mean, just your blood circulation can't be very good with being cramped in the car, and you can't use the bathroom or whatnot. But there's those videos, and those aren't vans, those are cars. And then the people in the incredible tiny homes, the majority are female because it's so affordable to live there. It's only $200 a month versus the other places that have tiny homes are usually at least $600 to $800 a month. Some I've seen for $1,000. So, you know, it is a major decision, and we don't know the answer because, I mean, we've even looked into going to a different country, haven't we?
Yeah, we sure have. I mean, there's options in other countries too, but you have to take into account that it's, first off, it's another country, and secondly, do they speak your language, and how well will you assimilate into another country? Some people look at that as excitement, and, you know, that would be great. Let me go to another country. But then some people think about it as it's going to be a challenge every day. And, you know, where am I going to do this? Where am I going to do that? What's going to happen if I have to go to a hospital? what happens if I get sick?
Yes, of course, it will be a challenge every day, but even if you go to the hospital without insurance, it's going to be cheaper than here with insurance.
Oh, true, yeah.
But
yeah.
we're looking into Ecuador, Portugal, Costa Rica, where else?
Yeah, I had a friend of mine who's from Romania, and he was saying that for public hospital doctors, it's like $300 a year. And if you wanted private, it's close to $1,000 a year, for anything.
For the insurance.
For the insurance to go to a doctor or a hospital for any reason. And he was saying how affordable it is to live in Romania. Well, I mean, it's all well and good, but you got to think about it's cold. He said that mostly everyone speaks English, but I'm sure that there's English that they don't, areas where they don't speak English. And it just seems it would be very strange living that far from the States and in a colder Eastern European climate.
I don't want to go to cold because I think it would hurt our bones, which is why Virginia is kind of being ruled out because it snows and it's cold up in Virginia. North Carolina can get cold, but I think Hickory is not. It's not as cold. So there's a lot of concerns. I mean, now Georgia has favorable tax laws for retired people, and North Carolina does not. And Tennessee is a tax-free state, but they do tax retirement income if you didn't earn that in Tennessee. But they have a waiver, I believe. But you could talk to an accountant. But I believe it's $65,000 per person if you're over 65. But Georgia has very favorable laws for retired people. So that's one reason why we should stay here. But Atlanta is outrageously expensive because we are one of the fastest growing states. Everybody's moving here. And as they move here, they're building more newer housing and they have to build schools and infrastructure. So things are getting quite costly here. Everybody thinks Atlanta is just dirt cheap, but it is not because the housing is brand new. So I think you'd be hard pressed to get a house, even $400,000. I don't even know if you get one for $400,000, but 5 to 6. If you're going to spend $400,000, you might get a townhome. And if you just want a basic house, even a 2-bedroom, probably be $500 to $600, because there's not a lot of 2-bedrooms unless they're marketed towards retired people. So yeah, when we take Social Security, well, it's going to be dependent on how healthy we stay and what happens in the next few years. We revise it constantly. And if something happens, we may take it sooner. And then, of course, we don't have pensions, so it depends on what the stock market does on how much money we will have in the stock market. So
stay tuned. Don't forget, subscribe, hit notifications and thumbs up, and find out what we decide to do on Social Security. More information to come.
And look for our other videos. We got our new member of our family. Right?
Yep, Sammy.
She's adorable. Little 4-pound puppy. And we still have Sierra, who's such a good girl. Sierra's 13, Border Collie. We appreciate her more than ever. Now that we have a puppy who is getting into all kinds of trouble.
Absolutely. So, Sue, when was the last time you had a good night's sleep?
Over 3 weeks ago when we got her.
Oh, yeah. There's nothing like a puppy that wakes up every few hours and is aggressive, and how you have to take them outside and feed them and take them outside again and then give them a drink of water and then take them outside again. And, it's a never-ending cycle.
And it hasn't rained in 6 weeks, and I hear it's starting to rain right now. So last night it rained for the first time, and we were out in the rain trying to get her to go to the bathroom. I had her out 5 times, getting soaking wet, and it wasn't raining that hard. She would not go, but finally the 5th time she went.
Yeah, and it's all teaching and training, and that's what we're working on because we want her to be housebroken and we want her to listen, just like Sierra, who is a perfect dog at this point. At 13, she's a perfect dog.
We didn't know how perfect she was.
Right. So you have a comparison.
Yeah. So check out those other videos. Until we see you again.
Take it easy.